So now that we've treated the extensor muscles, now we can go to some of the more deeper muscles that are now going to be much more accessible now that we have relaxed the more superficial tissues. The two muscle groups that we need to go after next are, number one, the Quadratus Lumborum, which is super important. That's the one we're going to cover here first. And then after that, we're going to be looking at the multifidi and the deeper muscles in the spine that go vertebrae to vertebrae. We call them the paraspinals. So number one, let's move to the Quadratus Lumborum because it's convenient and it's a nice lateral step from the erectors. So the Quadratus Lumborum is a very important muscle. If you review your anatomy, it starts on the iliac crest and goes to the bottom of the rib, okay, the 12th rib. And it also attaches to each of the lumbar transverse processes. Its primary function is going to be side bending, okay, of the spine, but it also will hike the hip up, okay, and bilaterally it may contribute, depending on the position, to extension or flexion of the spine. Very, very important muscle. It's oftentimes an area that refers with trigger points down into the hip. It can refer down into the SI joint, okay, oftentimes littered with trigger points. It's an area where there's a lot of sensitivity, so definitely an area we want to address. The challenge with the Quadratus Lumborum oftentimes is feeling how far out it goes, okay? So some people will have a very wide spinal extensor set, okay, and it'll seem to kick your fingers out as you start to try to treat the muscle. So you have to try to maintain medial pressure as you go down toward it, okay? Some people, it might be very difficult to treat this muscle because their iliac crest is very close to their 12th rib, so it feels like there's not a lot of space to get down in there. And again, you're going to find this as you treat more individuals, the variances in people's body structure, which makes it easier or more difficult to access certain muscles. So the first thing that we're going to do is we're going to apply our lubrication, okay? As always, I'll say it a million times, don't put too much, okay? We want to maintain some degree of friction. Now with this muscle, we're not going to be using elbow glides. We're going to be going right to the fingers because it's smaller, okay? And it's very difficult to get an elbow into this region. We don't want to be putting pressure as a caution here on that 12th rib. We need to be very cautious of that, okay? So once I find the top of the iliac crest, okay, and just lateral to the spinal extensors, you can feel as you glide on the spinal extensors, you can fall right off of the side. Once you fall right off of the side, that's where you want to start pushing down, okay? And as we go down, we're going to hit some of that connective tissue as the extensors and the fascia connect on the iliac crest, but that's where we're going to begin our Quadratus Lumborum treatment. I'm going to start with inferior to superior glides first, and I'm going to walk essentially right next to that spinal extensor as I glide up. Okay, so again, for purposes of the camera, I'm not going to use two hands, I'm just going to use one, and I'm going to pull down on the skin a little bit, okay? I push down and I glide straight up until I feel that 12th rib. And I'm not aggressive at jamming my finger in that 12th rib, okay, because we want to be gentle with it. We repeat that exact glide, and you can see I'm only moving about 3-4 inches here. It's not very much, but that's all I've got in terms of space. So as I keep gliding up, I'm seeing a little bit of twitching, hitting some tender areas right when you get to approximately the L3 level. Okay, so about 5 glides at minimum. Of course, you're free to do more depending on how sensitive the tissue is. You might need to do a lot more glides to get the person comfortable, especially if it's exquisitely tender. And once I've got my 5 glides, I'm going to move laterally about 1 thumb width. The iliac crest is going to start rising as I move laterally, so I'm probably going to have to be positioned a little bit higher. And again, gliding all the way up to the 12th rib, so the iliac crest is higher and the 12th rib is lower, so there's even less space here. I'm only getting maybe 2.5 inches of movement in there. Okay, be aware that we're pushing at that same 45-degree angle as we did with the extensors. Okay, so it's more comfortable rather than pushing straight down to the table. Once we've got our 5 glides, okay, we can take that third one. Okay, we take the third one, there's not a lot of space here, right? The Quadratus Lumborum is now starting to run thin at that point, so I might have to push medially as I treat it a little bit as well. Okay, so we want to make sure that we're being very thorough with that tissue. Okay. Now once we've got our 5 glides on that, so I did 3 distinct rows, now I want to go superior to inferior. So when we go superior to inferior, again we locate the 12th rib, and we're going to go just inferior to the 12th rib. Okay, and again, just lateral, falling off of the spinal extensors. And I glide straight down. Now here's our opportunity to push down and try and sink down and under the iliac crest. Okay, we don't want to flip over the iliac crest. It's oftentimes kind of ridgy there, and we don't want to be jamming or sliding soft tissues over that ridge, which can bruise and damage them. Okay, so be careful of that. And also, if you've ever had a massage where somebody glided their elbow over that area, it's very uncomfortable. So as we glide down, again, the 45, trying to dive down underneath that iliac crest where those inferior fibers are of the Quadratus Lumborum. We're going to get our 5 repetitions there. Okay, then I'm going to move laterally and continue. And again, this muscle is oftentimes very tender for people, especially when we get to L3, L4 region. Okay. And as we move laterally, again, still trying to get underneath that to the anterior side of the iliac crest. You're not going to be able to, but that's the intention of the direction. Now, once we've gotten 5 glides on each of those, it's difficult here to cross-examine the fibers in the middle because we're oftentimes pushing that tissue down, okay, and there's nothing really to anchor it to. So what I'm going to do is start with cross fiber of the attachments on the 12th rib. Again, with a caution, be gentle with this. So I identify the 12th rib. I start as medially as I possibly can, just falling off of the spinal erector. Okay, hand's going to go over the top so my fingers are together. Okay, there's my spot, and I'm going to do the best that I can to push gently up against the rib and glide across those fibers from medial to lateral about 5 times. Once I have my 5 repetitions, I'm going to glide laterally a bit more. That rib is floating quite a bit out here, so you can be more gentle. Okay, getting 5 repetitions, moving medial to lateral. Okay, now while we are here, we can go back and then go lateral to medial. Okay, again, there's not much to grab onto here, so make sure you're pushing down enough to feel those fibers in there and then gliding them medially. Okay, it's a little harder to get them on the lateral side, okay, but as you move medially again, you'll start to be able to feel more tissue that you can glide on. Not just moving the skin over the muscle, make sure you're pushing down to flip across the fibers. That's going to positively impact them. Okay, now once we have that, then we're going to jump down to the iliac crest and we're going to repeat that procedure. We flip off the side of the extensor, okay, and then we can make our contact there, start medially, 5 repetitions. Okay, when we move laterally, again, the lip of the iliac crest, it starts to rise, so we just follow it, okay, grabbing our tissue and frictioning, gliding straight across it. Okay, we could probably get about 1 more here, so I'm going to go ahead and go for it. Okay, there we go. So now we have done superior glides, inferior glides. Okay, we have done cross-frictioning at the 12th rib, cross-frictioning at the iliac crest. Okay, we go lateral to medial, right? We don't forget that one. A little easier to go lateral to medial on this one. And usually not so tender at the iliac crest, but it depends on the person. Okay, there we go. Now we have one more area that's highly effective to treat on the Quadratus Lumborum, and that is the attachment points on the transverse process. Okay, now your ability to get to the transverse process and to feel it is massively different depending on who you're working on. If you've done a lot of the superficial work that we've done to this point, it could be much easier to get there. For some people, it may not even be possible within a few sessions to get down and to make contact with that transverse process, especially on well-trained athletes who have a lot of strength and development in the erectors and in this area. You may never feel that transverse process, and that is okay. So what we're going to try to do anyway is to follow the same methodology to start treating into the direction of the attachment. That's really what we're going to look for, okay? So when we deal with the transverse process, it's very easy to locate where we should be at because all we have to do is identify the spinous process, okay? So if we start as low as possible, okay, in our L5 vertebrae, just remember that if we go laterally there, we're not really going to be able to make contact with anything because this is a large area where there's connective tissue and it's the region of the iliolumbar ligament. We're going to be treating this separately. So I want you to start at L4. So we start at L4, there's my L4 spinous process. Okay, as I go laterally, I'm going to wait until I drop right over the edge of the spinal extensor. Okay, so once I start to feel that ridge of the spinal extensor, then you're going to feel that your finger is going to sink straight down. That is exactly where we're going to put our thumb. So I'm going to trade that out. My thumb is going to go right there. Okay, and again, if you have an electric table, you might want to lower the table down a little bit more to get some leverage. Okay, but in this position here, I'm going to push straight down toward the table. This is one of those occasions here where it's okay to push straight down on the table because we're much more lateral than pushing straight down on the extensor. Okay, so as we push down, we'll often get tissue resistance there. We'll oftentimes get a little bit of threat guarding as it's very sensitive. Okay, and in that area there, we have a number of options. If it's very tender, I oftentimes will start with ischemic compression. So I will hold that. Okay, let the person resume normal breathing and reduce the threat and the guarding. Wait until that drops down, and then I will reposition and move to the next one. Okay, you can do the cross fiber here, although I will warn you it's oftentimes very tender. It's not the thing that I will start with. Okay, so once we've done that, literally, if you reposition your thumb about one thumb width up, we should be pretty much in line with the next spinous process. In this case, will be L3. And again, I'm right over the edge. I push straight down. And as I push straight down, I'll be right on top of that transverse process. Okay? And we're going to hold until that starts to diminish, again with that ischemic compression. Okay, and once we feel that release and communicate with the client that the release has happened, we're going to reposition about one more time. And I say one more time because you're going to make contact with the L2 spinous process, okay? And we're going to run into the 12th rib here pretty soon, so we have to change our technique just a little bit. Now, this level right here and the one above, very, very tender, okay? So as we get up there, we cannot push the 12th rib up because it's starting to hang down and getting in my way. So what I'm going to do is I'm going to change my angle a little bit more at a 45-degree angle, but everything else is still the same. So I almost have to kind of go up and then push down. So I'm kind of doing this type of motion here, staying lateral to the extensor and then holding that downward pressure, usually very, very tender in this area, okay? So be gentle, make sure we're not going more than a 6 or a 7 on our 1 to 10 scale. And once that releases, we have an option. We can go back through the area and then do ischemic compression to further desensitize the tissue. Or of course, again, if the patient can tolerate it or the client, we can do cross fiber work, okay? So cross fiber is a little bit less specific in this area, okay? Because we can't really feel the transverse process. That's really what we're trying to focus on, is making contact with it. That's our attachment points of the Quadratus Lumborum. But either one of these techniques is acceptable on this section, okay? So once we have treated that, I can go through and do 5 superior, like I'm going from top down toward the transverse process, okay? 5 repetitions, okay? Then I've thoroughly treated the Quadratus Lumborum, okay? So to recap, we did our inferior to superior glides, moving from medial to lateral. We turned around and we did superior to inferior glides, medial to lateral. We went back and did cross fiber frictioning of the attachment of the Quadratus Lumborum on the 12th rib. We did cross fiber work, medial to lateral, lateral to medial on the iliac crest. And then we went back finally and did static ischemic compression on the transverse process of each level. And also did a little bit of cross fiber from a top-down cross-fiber motion to push down onto the transverse process on each of the vertebrae that I can make contact with. Okay? And that will give us a thorough treatment of the Quadratus Lumborum. At this point, you can switch to the other side and make sure you treat each side to be as thorough as possible. And that's how we treat the Quadratus Lumborum.